Welcome and thank you for joining Infectious Disease Diagnostic in Namibia and Southern Africa. This webinar is organized in cooperation with Business Turku, Finland, South African Cooperation Institute, Finnpartnership, World Trade Center Turku, and Enterprise Europe Network. Before I introduce the speakers, my name is Megumi Hayashi. I represent Business Turku and Women's Health Hub Finland. I'm going to introduce the Women's Health Hub a bit later. But first, I would like to introduce shortly about Enterprise Europe Network, one of the organizers of this webinar. As the name says, Enterprise Europe Network is one of the largest network of organizations to help SMEs to find international partners. We work, as the name says, as a network, and we have 50 plus organizations around Europe. And the main thing we do is to we give advice in internationalization, and we support SMEs to find light type of cooperation companies in different countries utilizing the network. In Finland, we have 13 partners members, and we serve the SMEs in 7 locations, including Helsinki and Turku, where we are located now. And I would like to say a few words about Women's Health Hub Finland. This open network ecosystem is launched in Turku last year in May. And to address this challenge in the world, that women represent half the world's population, but only about 1% of all the healthcare research is dedicated to women-specific conditions and disease. And the big report was published last year by McKinsey, and this is becoming a big world trend at the moment. So to address this challenge, we are located in Turku on the southwest coast of Finland. And luckily for us, we already have large international corporations such as Bayer, Revity, Organon, and Orion in our region. And even more fortunate that these large companies are ready to cooperate together. And on top of that, we have about 100 smaller companies of life sciences field. So why don't we do something together to address this problem to improve the health outcome of women? So we have launched Women's Health Hub Finland. This works as an open ecosystem, and as Business Turku, as a non-profit business service organization, placed ourselves in the middle as a bridge maker to connect public sector companies, business, and the healthcare professionals to together address this challenge. We strongly believe in evidence-based technologies that we can provide, and we also believe in a solution-based approach that we want to provide solutions to existing problem. And this is one of the reasons why we are organizing this webinar today. And together, what we want to do is, first of all, enhance the visibility of the challenge that we are facing, and also the business opportunities that challenge provides for us. And another big topic for us is to start up new R&D activities nationally and internationally. This also depends on the funding, but this is maybe something we could do together. And we are open for cooperation, still in the middle of formulating all the activities together. But there are lots of interest within Finland and internationally. So let's make things happen together. Okay, so this is the introduction of Enterprise Europe Network and the Women Health of Finland. So without further ado, I will pass the floor to Mr. Kalervo Väänänen. He can introduce himself.
Okay, yes, thank you very much. And first of all, I like to thank the collaborators here. I'm representing this Finnish-Southern Africa Cooperation Institute, and I will shortly explain what that is, because it's a very new entity. And as a background, I like to explain that Finland has built a network of science and culture institutes. The first ones were established already in late 1960s, and now we have 17, and this Finnish-Southern Africa Cooperation Institute will be 18th. And this is actually the first one in the Southern Africa. We have a very small, quite small entity in Benin, which is mainly for the culture exchange. And but the difference between our institute and the other is really that most of them have science and culture on their agenda, but we have also, in addition to science and culture, also business. And as I mentioned, we are a very new organization. We get funding from the Finnish Parliament at the end of the last year, and started actually the actions during the second half of this year. And now we have institute established in Namibia, in Windhoek, and started actually operation. We get the legal status in Windhoek in last August. So we have a very short history. However, our purpose is really to enhance collaboration between the Southern African countries and Finland. And in order to do that, we plan to increase collaboration and be like a facilitator between institutions like universities or applied sciences, as well as the business entities between Finland and the Southern African countries. Now, in the beginning, we are especially focusing on Namibia, and this is because we have very long historic collaboration with Namibia, going back more than 150 years already. And then I hope that already during the next year, we could also start some activities in Botswana, and hope that then later on also in other Southern African countries, like in South Africa. And really the main purpose is to try to stimulate and enhance collaboration between the different actors in Finland as well as in the Southern Africa. And why we have, I already mentioned that we have a very long history between Finland and Namibia, and that was one of the reasons why Windhoek was selected as our basis. And in addition to that, when we make the analysis about this, we find out that actually it is a very good gateway for the Finnish actors, like Finnish companies and other institutions, to the whole Southern Africa. It's very easy to reach Windhoek from Europe. There are several flight possibilities, and then there are good connections from Windhoek to other Southern African states. And okay, so I will now in this slide you can see some basic information concerning the Southern African countries, and of course those participants who are there probably know better than us, and these are the little, I think this is 2023 statistics, and there are of course changes after that. For instance, in Namibia, the census was done at the end of the last year and the beginning of this year, and I think the population was found to be about 3 million instead of 2.6. But as you can see, there are in this primary area where we aim to have actions, Botswana and Namibia are very small countries. Well, they are roughly the same than Finland. So we are in the same category. In Finland, we have something like 5.5 million inhabitants, and in Botswana and Namibia, it's roughly the same amount together. And population growth in the Southern Africa is clearly bigger than in Finland, how in Europe generally. However, it is not that high than in most of the sub-Saharan Africa. And if we look at the health sector, the GDP per capita, you can see that actually these three countries, which also belong to the group of democratic countries in Africa, they represent the highest numbers per capita. And then when we look how much societies are used to healthcare sector, it is obviously less than in European countries. And again, you can see that if you look these three countries where we plan to have primary activities, these are clearly higher than in being highest in the South Africa and Botswana. These are clearly higher than in most of the sub-Saharan Africa. And what is, I think, if we look at the healthcare sector and especially the possible business activities in this sector, it is clear that it is a very nicely, actually quite rapidly growing sector, and roughly 15% of the population depends on the growing private sector, and there is also the growth in the public sector, which represents 85–80%. I think for us in Europe, at least in Finland, the surprise is that the private hospitals are very well equipped. I have visited some of them personally, and in summary, I think that it is clear that both the private and public sectors are growing at the moment. I think there are some features which are very typical and also very typical in Finland, and these are the distances are long, especially in Botswana and Namibia, as well in the northern parts of our country. The distances are very long, so there are clear problems how to arrange the healthcare sector so that it is it reaches everyone and the expenses are not that high. And I think here, when we think the diagnostics, especially the demand for the point-of-care type diagnostics is very, very big. So I think there is a clearly something I think which we can learn. I think the Southern African countries can learn from Finland and vice versa. And then I think another one which is of course the global phenomenon during the COVID is that the PCR-based diagnostics really expanded in many countries, including the Southern African countries. I think that the problem clearly is that, well, I don't know if that is a problem, but it's the fact that the disease profile are quite different in the Northern Europe and in the Southern Africa. But of course, this does not affect, for instance, to the equipment. But of course, then when we start to think that, for instance, what kind of panels we are using for the, no matter if it is a screening or the personal diagnosis, means that there we need a lot of collaboration in order to find out what are the best possible panels. And here is some figures concerning the in vitro diagnostic market in Southern Africa. And if you look the whole Africa, it is these are from Statista Botswana, I think the data, and our director or institute in Southern Africa, Dr. Sarutsai Mutana, has collected the data for me. So thank you, Saru, for that. So the whole market is roughly 2.5 billion during this year. And South Africa actually represents about, I would say, roughly more than almost 25%, between 20 and 25% of the whole African market. And it is roughly half a billion. And it has been estimated that it is growing, so that it will be more than 550 million during the 5 next years. Of course, in Namibia, the numbers are much more smaller. The market has been estimated to be something like a little bit over than 20 million at the moment, and the yearly growth rate is between 3 and 4. And so expected to be something like 25 during the 5 next years. And if you compare this, for instance, to Europe or to United States, which has the biggest revenue at the moment, which is more than 30 billion US dollars. So I think that just to make the conclusion here is that there are many things which are supporting that the growth in the Southern African region will be quite remarkable during the following years. And what are the reasons behind this growth? And I think that if you look the whole healthcare sector as a whole, one can make the conclusion on the basis looking what are the political intentions in these countries, that there is an expansion of the healthcare sector as such. So I think that there is a lot of pressure to improve the healthcare system. Another thing is that all these countries are now have established the education of the medical doctors. They are increasing the education of nurses, etc. And general increase awareness of infectious disease like HIV, tuberculosis, malaria, HPV, and so on is clearly increasing. And then there is another reason is that also when the also this chronic and lifestyle related diseases is clearly increasing, which of course means also that there are another set of diseases which demand more precise diagnostics. So another thing is that there is also demand for the preventive healthcare and screening initiatives. And in this area, the governments and healthcare organizations are putting more and more emphasis on early screening and preventive care. And I think that especially this area is something which we have a lot of experience in Finland. And I hope that at some point we can share this experience and maybe offer some models how to arrange that. Of course, one had to keep in mind that there are always very much and many important local factors which are affecting. So I think you can't just implement exactly the same type of actions than for instance we have been doing in Europe, but you have to take care of also the local demands. And then I think that what is the most remarkable trend or strongest trend is that there is a very strong trend towards the point of care type of diagnostics. And this is, of course, as I mentioned, the distances are long, so there are, from that perspective, there is a lot of emphasis to develop that type of let's say quite rapid and easily movable diagnostic. And then if we look I mentioned already earlier that the disease profile, both in infectious diseases but also in other diseases, there are differences. However, I think that if we look these really the large or big diseases, there are a lot of those which we had, for instance, tuberculosis, which was very big problem in our, for instance, when I was in a medical school, still tuberculosis, one of those which we studied a lot because it was so common, and now it has almost disappeared. And of course, there are many other examples. I have just collected here some of the diseases which are clearly keep a burden in those areas. Of course, many of those like respiratory infections and sexually related infections are well known here. We don't have malaria at the moment, but it is still a demanding issue in many parts of the Africa. And I think that one thing which I would like to mention here is that there is also important aspect, and that is the antimicrobial resistance. And actually, I think that if I saw correctly, my friend Antti Hakanen is on the line. Antti, would you like to comment this, especially the antimicrobial resistant issue? Antti, are you there already?
Yeah.
Okay.
Do you hear me? Yeah. Good morning, everybody. I'm on a summer cottage or November cottage here in Turku archipelago, and my connection is quite bad, but that's why I don't turn the camera on. Yeah, thank you, Kalervo. Let me introduce myself. I'm the head of diagnostics and pharmaceutical services in Turku University Hospital. My education is medical doctor and clinical microbiologist, and I have been doing antimicrobial resistance research for years, maybe decades, but it doesn't sound so good. But my experience from Namibian settings comes from a PhD project we made as a Kotutel project in between UNAM and University of Turku, and our PhD student Erastus Haindongo dissertated last autumn, and his topic is mostly Staphylococcus aureus, MRSA, and also E. coli ESBL producing strains. Had to be honest, we don't know very much about the global setting. Of course, we can see nice pictures from Europe and elsewhere, but the research and continuous surveillance behind there is very dependent on the area, and one of the project's goal was to first see what is the African situation. We know and had to say there are many white spots on the map, and we have now tried to cover the Namibian spots to get some more structured picture. The diagnostic normally is made there by a company. The AMR testing, it's called Namibian Institute of Pathology, and we have now published some figures from there, and also we have very interesting ongoing projects, hoping to get them out early next year concerning these topics. The situation in Namibia is I think, like I tried to explain, we don't know the exact figures, but we know some tendencies, and we can say that it's not very bad, but of course there is similar kind of resistance situation like in many developing countries. We have MRSA strains, some, let's say, roughly 1/3 of Staphylococcus aureus, and ESBL strains are also there. What is very good, we didn't see any carbapenem resistant isolates yet. Yeah, I can fully agree what Kalervo told about the diagnostic in general. It's of course very different from Finnish and other places in the northern hemisphere, but had to say that the situation is they are very eager to get it running better, and I think hospitals are of course the hotspots, but coming to the geography and population, I think point of care is more than needed in most of these countries in the southern African area. But that as in short. Thank you.
Thank you, Antti. And as we most of us know that this resistance question is increasing and it's becoming a very hot topic during the following years and decades. And I think that I have almost used my time. I just want to say a couple of more things. And this is, I think that everybody who is planning to work in the African area concerning the diagnostics should be in touch with the African Society for Laboratory Medicine, which is the Pan-African organization and is a laboratory arm of African Center for Disease Control. And they have a lot of activities related to, for instance, to education and so on. And these are mainly funded by the European Union is one of the funders. European World Bank and MasterCard are the main funders of this African Society for Laboratory Medicine. And of course, also the local in our case, when we are dealing with Botswana, Namibia, and South Africa, for instance, the local regulation is also quite well developed already. And well, this is just to I just recently noticed that there is a convention on diagnostics coming actually already in a couple of weeks. It would be very interesting to go there, but unfortunately, I think personally I'm not able to go this time. And just as a last slide, I would like to mention that this our institute, we have selected medical diagnostics as one of the main areas where we try to promote collaboration between Finnish actors and actors from the Southern Africa. We arranged already this year, just a couple of weeks ago, some seminars in Windhoek focusing on HPV and also on this antimicrobial resistance. And for the next year, we have planned to have 2 or 3 days seminar focusing on in vitro diagnostics, either in Windhoek or Gaborone in Botswana. We have not made the decision yet which one, but I think that after a week we already will make the decision what is the location. And we are very much looking local collaborators. So if you are interested in acting, so please contact me or some other person in the institute. We would very much like to arrange matchmaking events during these symposia, and especially in collaboration with Finnpartnership. And in addition to this business-to-business type of collaboration, we would very much like to also facilitate collaboration between the research institutions. So I think that was my time, and I just finish here and are happy to answer any questions you might have. And I think Jessica will explain in more details than, for instance, the role of the Finnpartnership in this area. Thank you.
Thank you, Kalervo. And if you have questions for Kalervo, please just open your microphone and go ahead. Or you can feed your questions to the chat. If just not now, but now I'm going to give the floor to Jessica. And Jessica will introduce Finnpartnership and its funding possibilities.
Excellent. Thank you very much, Megumi and Kalervo, for the introduction. Just one moment, I'm sharing my screen over here. I'm seeing in the chat that we're being wished a wonderful morning from the beautiful Namibia. I wish I could say the same, but unfortunately it's a little gray and cold and rainy, but nevertheless it's a beautiful day to be here to talk about Finnpartnership and what we do. So my name is Jessica and I'm a program officer here at Finnpartnership, which is a program that supports Finnish companies and organizations to internationalize to developing markets like Namibia in sectors like healthcare. So very relevant for this conversation today. Very briefly, we are a publicly funded program by the Ministry for Foreign Affairs of Finland, and our services, both for the Finnish companies but also for companies in our target countries, are always free of charge. And quite nicely put, our mission is to build a better world through business partnerships. And you may ask how we do that. And that is through the actualization of the 17 Sustainable Development Goals. And As you can see here, that means our scope is rather broad. We are sector agnostic, means we work in all sectors and in all developing markets. But I can already see here, very relevant for today's conversation, would be good health and well-being, reduced inequalities, and decent work and economic growth that comes through these developments in business partnerships for example, diagnostics. But that is very briefly what we do, and the way that we work with Finnish companies, but also companies in our target countries like Namibia, is through three main avenues. And because I can see that we are a diverse list of participants, I'll go briefly through all of them, and I'll try to keep it more at the high level to keep things brief, but I'm always open for questions here today, or you may also reach out separately should you have something more specific in mind. But first and foremost, it's our business partnership support funding instrument. And this is our funding that can be applied for by Finnish companies, public institutions, research institutions, or associations. But our funding is also available for companies registered abroad with the condition that they have at least 20% Finnish ownership. And importantly, our application is also open for consortia, which means a kind of group of several companies or organizations who are interested in our funding. I'll go through consortia in a little bit more detail later on, but here we're seeking synergies that come from working together. We also have this support function project, which is specifically for NGOs and educational institutions or foundations in Finland. And this is an exception in that we're not seeking for-profit partnerships with this grant type, but rather this would be tied to an existing financial grant project that is seeking commercial viability and long-term business. A little bit about the grant. It's minimum 15,000 and maximum 400,000 for projects entirely outside the European Economic Area. And in the next slide, we'll go through the support percentages and what that means, but it does depend on the target country, and it also depends on the size of the Finnish company applying for our grant. Just very importantly, our grant is always paid retroactively. This means that the project must be implemented prior to requesting the reimbursement, which means that when planning and designing your business partnership support project, it's always very important to tailor it to existing financial resources. Here you can see a map of where we work. Finland over here, up here in orange, and here the green countries are what is classified by the OECD as upper middle income countries, and then we have in blue lower middle income countries and least developed countries, and then extremely fragile countries. And here, how I said earlier, that the support function depends on the size of the company and the income status of the target market. This is what is meant over here. So, for example, should you be a small or medium-sized enterprise looking into going into upper middle income countries like Namibia, then we would see a 50% support percentage. And importantly, our income classification is the list that is by the OECD, which is updated, I believe, every 3 years. So even though the situations may be developed either that a country is graduating from lower middle income to upper middle income country, or the vice way around, at Finnpartnership, we do look at the OECD classification at that moment. A little bit of what kind of projects we support. A very wide variety, but at its core, we're either seeking long-term business partnerships or innovation projects in developing markets. Long-term business partnerships may look like establishing joint ventures with a local partner, establishing a subsidiary, or other types of long-term partnerships, which could be licensing agreements, subcontracting agreements, or franchising. But we do also support importing from developing markets to Finland, developing the existing businesses in a country, for example, through professional skills training. We have pilot projects that we support, and then co-developing a solution together with a local partner. And within that, our kind of support is classified into these different types of supportable phases, which I think are a really good indicator of what kind of things can be done with our business partnership support. So here, the first 5 phases are what we call preparatory phases, and this is the kind of pre-implementation stage. So when, as a company, you've discovered that there may be market potential somewhere, for example, through participating in a webinar like this, where you learn a little bit and you may think that, oh, you know what, that I actually have a product that could respond to these opportunities presented by Kalervo earlier. And at that stage, you could come to Finnpartnership with an application to apply for funding in relation to identifying a partner, conducting a project or feasibility study, drafting a business plan. So kind of looking at more realistically that, hey, we're really interested in going to this target market, but what specifically do we need to do in order to reach that target? And importantly, we also support assessments on environmental and social impacts, and also very relevantly, piloting technology and solutions. So if there is a pre-existing product or service that is working in Finland or in another part of the world, our support can be used to take that product to that target market and conduct a piloting of that, where we would provide the funds for the necessary investments and training and localization procedures to be able to test whether this product could have a good fit to that target market. Because as we know, a lot of the times, even though there may be similarities in countries, at the end of the day, very rarely can something be directly copy-pasted from the Finnish context into the different contexts. In addition to these preparatory phases, we also do support in the implementation through training of local staff, as well as the development of existing business in the target country, for example, to the degree that it relates to making operations more sustainable, expanding product portfolio, or improving the scalability of the operations. And within that, just very briefly, some information on what kind of expenses can be covered. And a lot of the times, a large chunk of the project is costs within these bullets. So travel costs, for example, to Namibia of the project team, employee work expenses, regarding to the project team members who are working on this business partnership support project, but we also do support external expert fees or consultancies in relation to the project. So if you are outsourcing a project study or the business plan, local consultancies can be used to support the Finnish company in this. And here, as I mentioned earlier, in relation to piloting, we do support the pilot, so necessary construction, necessary courier charges, training, the actual costs of the piloted product itself. And then here, the training expenses. So I think that's just in a very nutshell of what expenses can be covered. And as I mentioned earlier, our support can be up to 400,000 euros. Now, when we get to processing the application, it looks like this, where the company submits the application and required attachments to the MFA e-services, and then it comes to us here at Finnpartnership, where the application is processed. After the processing process, which often includes a round of clarifying questions to the applicant, it goes back to the MFA, who then delivers the government aid decision. And it's good to keep in mind that from start to finish, this can take 3 to 5 months to receive the decision. However, at their own risk, Finnish companies can already start to implement the project and start to collect reimbursable costs. Now, a little bit earlier, I touched upon consortia, and this is something that is very important for our target clients and Finnish customers to know and understand that often with consortia, the sum is greater than the sum of its parts. So the separate efforts differently may, at the end of the day, when you work alone, have smaller impact compared to if you go and work together with different companies or join forces with a research organization or NGO or educational institution. And we often see very positive synergies where working together, because a lot of these challenges that we're working towards are complex, and when you build a consortia of relevant actors that complement each other with synergies, we do see very positive impacts. And this is something that if you are considering building a consortia, Finnpartnership is happy to support, happy to organize a separate deep dive call where we can look together at what a consortia looks like, how the roles and responsibilities could be divided, and how we encourage this kind of multi-actor collaboration. So please, if you're interested in this kind of sparring service in relation to consortia, Finnpartnership is definitely the right address for that, and we have specific team members directly involved in this. Very briefly, I want to touch upon the EU Global Gateway Initiative, just because there are some synergies in relation to the health sector and Namibia. But just in a very nutshell, this is EU's geopolitical strategy, where they're aiming to mobilize up to 300 billion of investments in various sectors. And as we can see here, health is one of them, and it's a tool that kind of collects all the EU institutions and member states and DFIs together to work together for this global gateway strategy. And once again, for this, we do have a separate staff member who is happy to support with potentially finding relevant global gateway initiatives, and our previously mentioned financial grant is something that can be used to get started to tap into this opportunity. Now, as I mentioned, health is a global gateway priority, and there are some regional sub-Saharan Africa-related Team Europe initiatives, and we will be sharing these slides with the participants so you can look at the links in a little bit more detail. And should you want more information, then the EU delegation in Namibia would be your correct address. So that is very briefly about the services that we have specifically targeted to our Finnish companies who are eligible for support, also relevant for Finnish companies and our participants from our target countries is our B2B matchmaking service, which currently consists of 200 companies in 50 countries, including 3 companies from Namibia, and these are companies registered in our matchmaking database, which means that they are interested in finding a Finnish business partner, and we advertise and connect these companies to interested Finnish companies who, on the other hand, are looking for target company partners. In addition to this matchmaking service, our matchmaking services include the organization of digital meetings. We organize SDG booster workshops, as well as doing business with Finland seminars annually. We usually see around maybe 4 to 5 seminars annually. And for example, our next doing business with Finland seminar is in January in Malaysia. And this is an opportunity where we bring a Finnish delegation of companies around a specific sector, and we take them to the target country and organize these networking events where they're connected to interesting local stakeholders. This is something where if you online here today are a part of a company and you're interested in connecting with Finnish companies, we do highly encourage you to register to the database to benefit from our visibility, which we then market actively to Finnish stakeholders. And quite simply, this is what the database looks like. It can be filtered by industry or country, and it's open to anyone to look at to see what kind of interesting partners candidates are in different countries. And then, of course, to build those partnerships, our support can then be applied for. Just very briefly, our registration criteria do include that they need to be a part of our target markets. They need to be registered for at least 1 year and on a solid financial basis, and be able to describe what kind of business partner is of interest, because then that makes our efforts more relevant when we know what the target company is looking for. And finally, but not least, our information and guidance services. How we do this is through participating in different types of interesting events, like the event we have today, where we share about our services. Now, of course, in our 30-minute window, it's only able to keep things at a certain high level. But if you are interested in learning more concrete details about the work we do in our business partnership support grant, we do organize application workshops monthly. They're around a half-day event where we dive deep into the practicalities of what makes a business partnership support application successful, and also gives information on past supported projects. In addition to the application workshop, our staff is here at your service. So here I am in the middle. My name is Jessica, and I'm happy to support in all our grant-related matters. We have Axel and Topi here working on consortia building and a global gateway, and then Suvi, who is specifically working at for our matchmaking work. So please do contact us at firstname.lastname@finnpartnership.fi. But of course, you can also pop an email to our general email, which is very responsive, and we will then direct you to the correct staff member should you have any queries. We also have regional officers in Asia and in Ukraine, should there be specific interest for those target markets, and they're also at your service. I've breezed through this presentation in order to enable any questions. So please don't hesitate to ask a question now or take down my information and reach out later on for any matters in relation to Finnpartnership. But maybe just a final comment to bring this back to the topic of today, Namibia, infectious disease diagnostics. I do see a very clear business partnership opportunity here, and I would especially see perhaps building some sort of consortia to be very relevant, because especially in these types of sectors, I believe that there is power in numbers and different actors bringing different types of expertise to the table. And I do see that definitely utilize the information that Kalervo has shared today, utilize the institution, and do utilize our Finnpartnership support to then fund these ventures.
Thank you, Jessica, for the presentation. And again, if you have any questions, please open your microphone and ask, or you can also feed your question to the chat. If not, you can of course always contact us. My name is Megumi Hayashi at Business Turku, and Jessica has already introduced her contact information, and Kalervo is here as well. And we will send all the presentation to the participants. And I would like to thank the speakers for the valuable information that they have shared. And I believe that this is going to be some fruitful cooperations, and we will disseminate the information to our companies of Women's Health of Finland, and we'll continue the discussion with Kalervo and Jessica. Thank you for the participants, and we will inform you our next event.
Thank you.
Thank you.